When I was a kid, I saw the doctor's office as a place of great excitement. I marveled at the fast pace of physicians walking door to door, checking up on patients. I was even comforted by the coldness of the stethoscope on my chest as I drew in deep breaths and gently let them out. I admired the pristine white coats that floated around. During checkups, I was sure that the healthcare team had my personal well-being at heart. In contrast to my experiences, the institution of medicine has not always had the good of the patient in mind. More often than I would have imagined, medicine has exploited vulnerable people. One example of this exploitation is the sterilization abuse of Mexican-origin women at the Women's Hospital of the University of Southern California, Los Angeles County Medical Center during the 1970s. Women of color had been targeted with sterilization before due to concerns with overpopulation and rising welfare costs. However, the pregnant Mexican-origin women of Los Angeles County faced additional issues due to their immigration and citizenship status. When they came into USC Los Angeles County Medical Center, they would be crammed into overcrowded rooms with uncomfortably bright lights, and doctors would harass them into signing sterilization consent forms during the most excruciating stages of labor. Oftentimes, doctors would prey on women's experiences with pain by withholding the painkillers women desired unless they agreed to sterilization. Women would also be approached immediately after receiving shots of Valium so that they were too groggy to comprehend the situation. In many cases, doctors would also lie about the procedure and circumstances surrounding the patient's labor to convince them into consenting to sterilization. Many of the women contest that under different circumstances, they would not have given the doctors permission to sterilize them. Even women who were not under such conditions were coerced into being sterilized. When explaining the implications of sterilization, hospital staff would not fully disclose the irreversibility of the procedure. Many women believed that having their tubes tied meant that they could later be untied. Thus, based on their belief that their fertility could be fully restored, they would agree to the surgery only to later be shocked to find out that they would never be able to have kids again. Furthermore, doctors would also tell the women about alleged C-section laws that only allowed women to have 3 C-sections. After women reached the supposed limit, physicians would explain that sterilization was subsequently required. They would also instill in women a sense of fear by deceitfully telling them that they would die if they weren't sterilized, which would influence these women into consenting to tubal ligation. These modes of manipulation were especially damaging to patients who did not speak English or were illegal citizens. During this time, lawmakers and the general public did not believe that these women were worthy of welfare benefits associated with having an American-born child. Due to these national discourses, doctors believed that it was their societal obligation to stop Mexican women from having children by threatening them with deportation unless they consented to sterilization. Thus, as Elena Gutierrez states, citizenship was used as a clear marker of those who were undeserving of proper medical care and, in effect, of membership in the national community. Not only a means of punishing Mexican women who were believed to be illegally using public health services, sterilization abuse also served as a means to eliminate future undesirable citizens. Rather than help their patients with the care they deserved, doctors acted on their biases against Mexican women to limit their reproductive freedom. It suddenly became clear to me that the confidential, personal, and sacred nature of the physician-patient relationship I experienced was not a reality for all. I now realize that viewing medicine in the brilliant light I did as a child hides the way in which marginalized groups experience harm, coercion, and abuse by the healthcare system. It blinds people like myself from seeing that the institution of medicine does not always have the good of the patient at heart as it might seem. Considering the ways in which medicine has done harm has challenged me to think about my future role as a healthcare professional. What I do as a physician will most likely be influenced by national discourses like those in the 70s, but I'm prepared to think critically about those discourses and the ways my actions will affect the lives of those with diverse backgrounds.